Okay, thank you. Good afternoon. Today's topic is program evaluation presented by Salem Taylor. Salem has been the executive director of the United Way of Stanley County since 2018. Prior to working for the United Way, Salem was the program director for Homes of Hope, a local nonprofit organization that addressed homelessness in Stanley County. She developed their transitional housing and emergency shelter programs and collaborated with community stakeholders to create a domestic violence and sexual assault program that became an independent nonprofit. Mental health, homelessness, poverty recovery, and women's programs are Salem's personal passions, and she's proud to serve her community through the United Way of Stanley County. With no further ado, I will turn it over to you. Thank you so much, Salem, for being with us today.
Thank you, Colleen. This is quite an honor. So I'm always happy to talk about subjects like this that I can really nerd out on. And I think that research methods was one of my favorite subjects in college when I studied psychology. And I'm fascinated by how it impacts the world of nonprofits. And it's one of my favorite subjects. So anyway, thank you for having me. I appreciate that very much. This is kind of different for me too. This is the first time I've done a meeting like this, and it's kind of weird that I'm like, I feel I can't see anybody's faces. So I'm just sort of talking to myself and, I'm checking out my office behind me. But anyway, so I thought that for today's discussion that I would sort of give some basic information, sort of an overview that I think is pretty applicable to anybody who works in human services. Because as a lot of you probably know, the program assessment, it gets pretty detailed and very, very extensive the more you go into it. Because there's a lot of different types of programs, and how you assess those programs is going to depend on the type of program that it is. So there's a lot of individual factors at play here. So I've got resources about that. I was going to show you one of my favorite resources. This is provided by the United Way, Measuring Program Outcomes, a Practical Approach. This is a manual that was created a few years ago by folks from about a dozen different nonprofits, everything from scouting programs to YMCAs to foundations to United Ways around the country. So it's got a lot of really specific instructions in there for assessing programs. But anyway, just to kind of get us warmed up just a little bit, I'm curious if you can put in a chat box, or just kind of, I guess, I don't know if you can raise your hand. I'm curious how many folks have had to do a program assessment or have had experience with it or are involved in it. So just feel free to just kind of, just pop in a little comment there. I'm just curious, out of the 38 folks we've got here, how many have had this cross your path directly as part of your job, just for just to kind of get a sense of that. I am going to share my screen with you guys. There we go. Let's see. I can get that. Patient with me for a second. I'm not sure why this is not actually doing it. Okay, let's see if I can. Can't seem to get to the full screen. I don't know what I'm doing wrong.
Try clicking home at the top there. Are you trying to run your
I am. Yeah, and it just doesn't seem. Let's see.
Or actually, slides show up at the top. Will that not do it for you from beginning?
There we go. Right, so I call this program evaluation for dummies because, like I said, it's just kind of a general overview that's to sort of just introduce the topic and some basic concepts to it. So when we say program evaluation, what does that mean in layman's terms, or in a simpler sense? It means determining if a service, program, or agency is effective doing what it's supposed to be doing. And it's how you test a non-tangible product. So in the human service field, there's a lot of that, right? The work that we do isn't a tangible thing nearly so much as a business that sells something or manufactures something. That's a lot easier to test. You can test the quality of those things a lot easier than you can non-tangible things. So the concept of program evaluation was created to test that. So why on earth would we do this? Lots of reasons, and I think that the prevalence and importance of this has really grown in recent years. In my experience in the nonprofit field, I think that the first 5 years or so that I was working in nonprofits, it was a concept that really large agencies would mention being done periodically or hiring someone to come in and do it. In a rural area where I work, it almost was unheard of. Now it's kind of a requirement for any kind of program if you're going to get very far. So program evaluation establishes a value. It's how you establish value. It's how important is this? How effective is this? Why should we be doing it? Why should you give to it? Why should you support it? It's how you measure your impact. That is a big buzzword in our field these days. Everybody's about impact. What are your impact measures? How much impact are you having? What's your impact report? It's on almost all of the marketing materials that I see. And that means, again, that's some kind of tangible or clear statement on what difference you're making in an issue. It definitely impacts your funding. If you're applying for any kind of grants, including United Way funds or even private foundations, and also even with your donors, if individual donors, people want information. They want to know more about why they should give and support what you're doing. What are they investing in? What is the value of their investment? What kind of outcomes are they going to see for giving you money? So it's definitely a critical part of that. So for small nonprofits and new nonprofits that are trying to figure out resource streams and get established that way, it's absolutely necessary to have a basic knowledge of program evaluation. As I said, with marketing, it's really critical for your marketing. Infographics are huge. Things are very data driven these days. Giving people a clear picture of what you do is important. So doing a program evaluation will give you some of that information. Restructuring. Maybe you've had some issues at your agency and you're not sure. It could be staff turnover, it could be lack of donor interest or other issues that have impacted it. Maybe you've got competitors in your field that you didn't have before. So you're trying to figure out where you stand. Should you make changes in what you're doing? This is a really good way to start looking at that. And as well for strategic planning with your board of directors and your staff. If you don't know exactly in a quantitative way where you are at right now, it's kind of hard to make goals for the future that are realistic, to understand your capacity and to understand if you're doing what you should be doing or focusing on what you need to be focusing on. So where to begin? The term stakeholders is a popular term, right? It just means who's involved, who cares about this, who's helpful with this, who are the people? Is it staff? Is it investors? Who matters in this situation? And honestly, I really start here with defining success. For some programs, that's super simple. For others, it's actually kind of a hard question. I'll give you some examples of some of the situations that are difficult to define. So when I worked in homelessness and I had that first student that was doing a program evaluation on us, that was our first conversation was, well, how do we define success? So at that time we had transitional housing for homeless families. And so we had these properties that we were using, and we were taking homeless families with kids usually and housing them in these houses and doing some case management with them and trying to help them move out, undo a place of their own. So we had this discussion, and it was, is our marker of success going to be that they moved out, that we didn't have to get them out of the program early due to noncompliance, or they weren't able to find housing, or some other issue, they completed it successfully. Is our definition of success going to be more than that? And how many things could we look at? So we kept it sort of simple because, again, this was a student project and this was her first time. But what she did was contact people that had left the program over the course of, actually, I think it had been in existence for about 3 years at that point. So she went back to the first 2 years, right? So she got in there and pulled those files and reached out to those folks who used to be in the program and had left it successfully, and contacted them by phone or email or whatever way she could find to reach them. And she had a list of questions that she asked them. I want to say, what was their income at that point was a question that she asked them. If they lived in the same housing they had moved out of our program into, or had they been homeless again or had to move again. And were they employed, or was their finances stable? I think those were the main 3 things that we looked at. I think she added a couple other questions, just like general feedback on their experience. You know, did they feel like it was successful? Did they feel like they learned a lot of things? At that point, we weren't doing any kind of a lot of data collection when they came into the program, or when they left. So we just were relying on our notes, case management notes at that point. So it was part, quantitative stuff, and part just kind of their impression and their experience. And then she compiled all that in a spreadsheet, and we looked over it, and then sort of put together a framework for that. So that's one example. I can think of another program, for example, that coordinates volunteers to drive senior citizens to doctor's appointments. That's a wonderful program in our community. How would they define success? How do you figure out what would happen if that program didn't exist, or what kind of measurable impact are they having? Without a whole lot of further thought, I don't really know on that one. That's one that's a little more of a gray area, or a resource center for addiction. We have one of those as well. How would you measure success for that? How would you get feedback from people? How would you measure the need for that in a quantitative way? So anyway, it really varies. Educational programs, I think those are some of the easier ones to assess to a degree, because you can determine at the entry level what the knowledge level is on that subject, and then assess at the ending how much they've learned. But then there's a lot of other facets to that as well. But crisis assistance, we have a crisis assistance fund for homelessness prevention. So a measure of success for that would be how many people 6 months later were still in their home and didn't lose their home due to financial reasons, or were able to stabilize themselves. Again, it's across the board, depending on the kind of program that you have, and how would you approach that. But there's a lot of resources for those specific things. So if you've got a program that you're not sure what your marker of success would be, I'll be happy to talk to you and see if we can figure out some information on that. So recidivism, I like to point that one out too. For financial, like, crisis assistance programs, something that is helpful to know how many folks came back, or how many folks had to get help again with an issue. If your goal is financial stability, how many folks were repeating or needed to use other services. If the goal of your program is to reduce dependence on other things, whether it's emergency room visits or shelters or whatever, it's another way that you can do that. All right, so going to, I think, yes, okay. So again, this is kind of testing on what I was just talking about. How you measure that. Once you've decided, okay, we're gonna say for the homelessness, how many folks kept their housing, okay? Then you've got to figure out, how do you measure that? It's going to be verbal, get phone calls, their landlord records or assistance records that you're going to look at, or whatever the case may be. It could be financial reports. If your measure of success is a financial one, that you've raised X amount of money, then obviously financial reports would help with that. That you've had contact with a certain number of people, if it's engagement, if it's volunteer engagement, then you would need to start keeping track of how many folks you had engaged and how long they volunteered. And I think a marker of success for that would be recidivism in a good way. You know, how many folks came back to do volunteering at another event, or wanted to engage in another project, right? Because consistent volunteers are hard to get, and I think they are most definitely a marker of a good program, because anytime I see an agency or a program that's got some regular volunteers, folks that have stuck around long enough and committed long enough to really understand that program and be there on a regular basis, that means that it's run well, that it's rewarding for them, that it's well organized, and that it's a good marker of success. Also, for your program evaluation, you need some kind of time frame, because you can't work on this forever, right? You gotta give yourself some sort of some beginning and end date, either for your data collection, for the whole thing, or whatever, so you can report to your board or to your other stakeholders and have an idea when you're going to wrap this up and move forward with what you learned from it. So I'll share a little bit of a little fancier wording and data here. I love this infographic that kind of shows the cycle of a program evaluation. So again, number one, starting with establishing the stakeholders, who's involved, who cares about this, who can help with this, explaining to them, the person who's doing it. This also assumes that you're not personally doing the program evaluation, that you're getting an outside party to help you with it. And there's something to be said for that. I think that it gives us fresh eyes when you work in something. If you're really immersed, it's a good checks and balance. It's a good measure to have somebody else involved if you can. If not, then you just do your best on your own to do it. But so step two is explaining to them what it's about if it's not yourself. Select the design of the evaluation. Again, how do you measure what your success is? What markers are you looking for? Step four, to collect that data, whatever that may be, whether it's surveys or reviewing records, doing calculations on things, talking to people, going through archive stuff, working in the community and asking folks, whatever that may be. 5 is generating the conclusions based on the data analysis, trying to decipher what it tells you. Sometimes it's really clear, and it's easy to see. Sometimes it's kind of jumbled. Sometimes it's a little unclear, and you've done all that work and you're not really sure what you learned from it, and you might need to dig a little deeper or take another step at that point. And 6 is state your findings and provide recommendations. So usually, you'll need to share that either with investors or with your board, or with those stakeholders or with the community, possibly, depending on the situation, what you learned about it. And hopefully it's a good thing. If you've learned something that shows you there's room for improvement, you might want to keep that internal for the moment, and then do some more evaluating once you've made some changes. But yeah, putting together some kind of report that's fairly simple and concise and easy for people to understand, that explains what you've done. So yeah, after you've done the work of gathering the data, evaluating the outcome, generating conclusions, are there any flaws? And did you learn what you needed to learn? So I think one of the flaws that we discovered when we did that very early one in the homelessness program was that we couldn't find a lot of the people. We weren't collecting enough information about them when they left to be able to reach them in the future, to do that sort of thing again. So that's something that we knew we needed to implement. And it also meant that maybe we needed to get some other data to support it. If we weren't getting reaching those people directly to get that information, what other ways could we find out? Could we reach out to the landlords that we had worked with, the apartment communities that they had moved into, and say, hey, is so-and-so still there, or do we know anybody in the area? Just trying to be creative and think of ways to compensate for that weakness. But sometimes you do learn either flaws in your system of evaluating the program, and maybe need to add another element to it and rethink it and do another level, or you recognize that there's an issue with the program. And again, did you learn what you needed to learn? Sometimes you might learn part of it. Sometimes you might learn great things that impress you with yourself and you think, man, I didn't realize we're doing that good. And other times you might learn that there's some major changes that need to be made. All right. And okay, so at this point, I will let you guys see if I've got some questions here in the chat box, because I'd love to hear from you and what kind of thoughts that this made you come up with as you were listening to this. Yes, I will share a copy of this PowerPoint with Colleen, and she can distribute it to you guys. More than happy to do that. So Gail asks, how to determine success when you serve people living with dementia? That is a great question. So I imagine safety is probably one of the concerns. I don't know specifically what kind of program you've got, if it's like case management or healthcare or residential facility. I would think that safety would definitely be a major factor of success. Quality of life. And I know quality of life is a little subjective, but quality of life includes relationships, environment, their overall health, whether or not they end up with other issues, or their basic needs being met, keeping their functioning as high as possible for as long as possible. I would imagine you would really need to get some input from their friends and family whenever possible to get there, because they would know that person the best and know what they considered success for that person. That would be my first thoughts on it. If there's more specific things, I would be happy to help you brainstorm on that and see what kind of measures we could that might be applicable to that sort of program. All right. Any other questions? I hope so, because we've got a little bit of time left, I think. Memory cafe. Okay. Memory cafes and day programs. Okay. Yeah, we have a day program here that I've given some help with as far as their resource development. And yeah, I would think family feedback. Family feedback would be a thing. When a person first enrolls in the program, I would try to get some information, some input from the folks that are supporting them, who are bringing them, who take care of them. What do they think is most important for that person? Is it socialization, safety, anything else that's a specific goal for them? And then having some way to assess that, or kind of monitor that, or get feedback from them on that would be the way that I would approach that initially. And again, you can go as deeply into that in terms of their health, in terms of their relationships, in terms of their quality of life, their independent living, or their need for assistance would kind of be something you could look at with that. Okay. Oh, this is like a juicy question. Any advice for program evaluations that involve pre or post surveys with poor completion rates? This is regarding lung cancer community education programs. Online events and virtual surveys have been particularly challenging with getting folks to complete surveys. Yes, that is a great question. Surveys, how do you get people to give you that information? I help I serve on a board that helps with our local hospital system and health department in doing a community health assessment every 2 years, which is sort of like a mini census here. And that's a problem there too, because, we have 60,000 residents in this county, but it's really, really hard to get like 2,000 or 3,000 surveys returned, which is not a great return rate, which doesn't give you great data. And I have to me, I have something that I always say, that nobody is as excited to give us information as we are to share it, right? Nobody but us gets excited about collecting data about stuff. So it's really hard to share that. So some strategies that we've used for for survey data. First of all, the faster you can get it, the better. I know that kind of goes without saying, but if there's any chance to collect that information from people while they're receiving a service, to hand them that piece of paper, that pencil, and like before they go out the door, ask them to do that. Sort of a captive audience. That's a good way. When you go to things like this, like to presentations or workshops, there's usually a little survey that they want you to do at the end of it, and they don't wait until you've left and send it in your email because they know they won't get hardly any of those back. But if you're sitting there while you're still listening to the person or while you're still in that seat, and it's in front of you, you're more likely to do it. For our point in time count of homelessness, which is another survey collection effort, we've had great success with going to places where there's a captive audience. So where do you find that? Places where people have a long wait. So we've gone to waiting rooms at the health department, social services, the community table. We haven't hit the DMV yet, but that will probably be a good captive audience too. People don't have anything better to do. So if you just, have a short spiel and explain to them that it really helps you with your information, that helps. So in your case, I think with the cancer community education programs, yeah, depending on how you do the education program, if it's in person or if it's online, I don't know from a technical standpoint, if you were doing something like this, like on Zoom that was online, how you would get people to do. I guess if you had a link, if it was SurveyMonkey or whatever, you could post a link maybe in the chat and then just ask everybody, please, while I'm talking, go ahead and click that link and give us a little bit of feedback about what you've learned today, or any other questions that you might have on that topic. So yeah, and also anytime you can give anybody an incentive, little things. The point in time count, which is, again, it's a community-based survey. We like to give out little things to people, even if it's a pen. People get so excited. Take a survey and you get to keep this cool pen. You'd be surprised. Sometimes it's not our little candy bar. It doesn't take much. We're all really kids, so a little trinket, a little memento sometimes will incentivize people to take a minute and talk to you. And we all know that it's typically men. Men are a lot harder to get to do surveys. That's the problem we faced too with community data. Was it's usually older women, women middle-aged and up, who will complete those for whatever reason. And it's really hard to get that input from other demographics. So you have to think of creative ways to engage them. All right, I'm going to click down just a little bit, trying to see what's all in the chat so I don't miss anything.
Salem, you have a question here that says, how would you evaluate an anger management education class? This class is just to give people a few tools to use in situations where they might get angry.
I would say, how many holes would you punch in the wall before you started the class? Holes are in your wall now. How many quality relationships do you have before the class versus how many quality relationships do you have afterwards? That's a great question. I'm being a little bit funny on that, but yeah. So when you think about what anger affects, anger definitely affects relationships and your job, right? If they're in an anger management class, then it's been disruptive in their life. The episode of The Office where Andy punches the wall, and they send him to make him go off to an anger management class. So it would be, I guess, stabilizing their employment, stabilizing their relationships, would be some of the markers of success that I would look at. Coping skills. How many useful coping skills did they learn? Give an example of one. Like, what's your favorite one that you learned during the class that you've been able to implement? That would be sort of what I would look at for anger management, just like off the top of my head. And again, holes in the wall or road rage or whatever. Okay, I'm going to look down here. Okay, lung cancer. I think we talked about that one. Surveys, but best to do survey during case management or just after the service or to wait a while. I wouldn't want to do it in a way that distracted from what you were doing. And I wouldn't want to do it at a point that you hadn't had a chance for that marker of success to happen. So I guess it would kind of depend on what the service was and how long you'd worked with the folks and what you were measuring. For example, with what we ultimately did with the transitional housing program was we would during the case management, I think about halfway through. Well, so initially when the person was accepted into the program, we had them identify what their definition of success was. Was it that they were able to get to move into public housing after they left? Was it that they would be able to move in with a friend or family member? Would it be that they had their own house or that they had an apartment? So we wanted them to kind of visualize what their success was, and also what their goals were. And then about halfway through the program, we kind of touched back on that and said, is this still realistic for you? Is that still what you're working towards? And what have you learned so far? What are you still trying to accomplish? To sort of encourage them to think about those things. And we'll record that. And then when they moved out, we document when they moved out, maybe a few questions at that point. And then to get a little more long-term data, 6 months or 12 months later, trying to reach out to them and saying, hey, just wondering how you're doing. Are you still in that place that you moved out where, you're able to keep it? You haven't had to move again or be homeless again? Are you still working or still able to do, just kind of getting a general sense of their, of how much we had stabilized or how much they had stabilized their life during the process in the program. So there was a little pieces of that all the way along, and then more after they had left the program. So again, I think it kind of depends, but if it's a program that's very short term where they're in the office and they're out, again, that would probably be something you would do more while you're with them. If it's resource referral, then it would be fairly quickly, did you get the information that you needed? Were we able to answer your questions? That sort of thing. Did that answer your question, Paul? I hope that was thorough enough. So somebody commented that if it's helpful to others, our organization provide housing counseling. They follow up every 30 days. Yes. To determine the outcomes. Yes. And because housing is complicated, that's a big financial puzzle. There's lots of things that affect that. So it does take some other questions. Relationship building. Yes. And that's true too. People are more likely to engage with you, to do a survey, to give you feedback if they have a relationship with you. Otherwise, it feels sort of telemarkety, or sort of salesy. It doesn't mean anything to them. But the better connection you're able to make with people that you're serving in whatever capacity, the more likely they are to do that. Especially if you say, hey, this would really help us out because we're trying to figure out, if we're doing everything that we need to be doing, or if we're doing it how it should be done. So if you wouldn't mind taking a minute to tell us how we've done. I also really encourage people to use apps for surveys. And I say this as someone who has not personally experimented with it a lot as far as creating an app that can be done on your cell phone. But if you could imagine a world where you could talk to people or ask people to just go on their phone and click a link and do a survey, you get a lot better participation, I think, in a lot of cases than you do mailing someone a survey and hoping that they mail it back. I think that's probably the one with the lowest return rate, next to maybe email if you don't have a relationship with them or you don't also reach out some other way. People just skip over those or delete them and don't take the time to do them. But captive audience is always good. Having a little incentive is good, and making it super easy is good. So that's one thing we're trying to transition our community health assessment process to being on an app or cell phone friendly, so that we can maybe pop into a lobby somewhere where folks are waiting for some services and say, hey guys, if you have a minute, we're trying to do this survey. Tell us about yourself. Tell us about what your opinions are. People love to share their opinions usually. So if you throw in that, you have a voice, we need to hear from you. We need to know what you think about this. That makes them feel heard and makes them understand the value in it, or find value in it that they might not otherwise.
That ties in with your next question here that says, I work for a long-term recovery group, and we're going to do a community satisfaction survey that asks questions about not only individual programs we have enacted, but also general satisfaction overall. We are hoping to utilize a survey via text, email, in-person, and form pickup. We're wondering if we should narrow our methods, if 4 methods of outreach is effective and not overwhelming for clients or confusing.
Um, hmm. So I'm imagining in that group of people that you're trying to get information from, you could probably divide them into two groups. You could probably divide them into a group that you have a relationship with, that you feel fairly confident you could reach or that they would give you feedback. Um, so I would approach that group a little differently, with whichever of those methods you think would be preferable for them, and easiest for you. If that's text messages or an email or whatever, you've already got them on a list. Those folks you're probably going to hear back from. And then the other people that you don't really have a good relationship with, I don't think it would hurt to use multiple methods on those. But you're right, you do have a little bit of a risk of overwhelming people if they are in fact being reached by all those four methods, because nobody wants to get a flyer in the mail and an email and a text message or whatever. I mean, I don't know. And then again, what's the cost if they're mildly aggravated by it, if they give you the input, as long as it's not too much. But I would think that people would appreciate it, would appreciate the intention of that. We certainly get approached in multiple methods by some people when they're fundraising or they're campaigning for a political party or something like that. So yeah, there's a fine line between being aggravating and being effective. So I would say take the path of least resistance to the folks that you think you have a clearer connection with, and then the ones that are kind of unknowns that you haven't heard from much or don't know very well. Sure, do mail and text and email, because you are increasing your odds that you'll that something will stick with them and that they'll be like, oh yeah. It's honest. So I'm kind of scatterbrained myself, and I'm super busy. And as much as I love data and research methods and things like that, I don't do a lot of surveys. I really don't. So it's got to be something that's either work related or meaningful to me in health and human services, or something that has a really good incentive or some kind of thing. I mean, I'm terrible at doing the customer service things on the receipts for the drawings and things like that. So I say that to say that it wouldn't bother me necessarily for someone to ask several times for my input on something. And sometimes I have had to ask several times and send an email reminder, the deadline for your submission is this, and then I'll be like, oh yeah, so I would say don't be too scared, I don't think, to aggravate people. All right, I think there's another question here that looks pretty juicy. If your program is aspirational, you are increasing the steepness of the growth curve, not saving someone. Youth or adults who are developing leadership and communication skills. They're already doing this, already working to grow. The question is more is our program accelerating their level of collaboration, leadership, or confidence? How would you measure that? Oh, that is good. That is good. First of all, some long-term data would be awesome, right? If you're working with youth and trying to develop some character, develop some skills in them, knowing where they are in 5 years would be incredible. What is do they have a career? Have they, what is their education level? What is their feedback in 5 years on how that program has impacted them? I just saw a Facebook post from one of our local high schools about a young woman who graduated from there in 2016 and had been involved in a club or a program there, and she went on to nursing school. And so they spotlighted her and her picture, and she gave some feedback saying, hey, this program and this teacher was really what made me feel like this was doable. She was a nurse, and so she was saying this is what really sparked my passion for the healthcare field. And it was this teacher that really made me feel like I could actually accomplish this back at that high school. So that could be a similar thing for a youth program. And that takes some long-term planning and multiple ways to contact them, not just their information, but maybe a parent or somebody that you could reach out to down the road and say, and get that information on how they're doing. Otherwise, it's really kind of subjective. Your immediate data would really kind of be, would have to come from like their entry, some feedback from them when they start, why are they there? Why are they participating in that program? Do they have interest in it? Do they feel any kind of, not confident or not where they want to be in some way? And of course, there's a lot better ways to word that. And then having some way to measure that at the end with the same question, saying, now how do you feel about this? Is it public speaking? Is it, pursuing something in education? Is it being involved in your community, or whatever your leadership character traits are that you're trying to develop in them, and just getting that subjective opinion-based data from them, how they felt about it, would really be the best way to measure that. But in terms of what's really going to be meaningful for funding, and for your marketing, is going to be several years from there. I would say between 3 and 5 years, tracking those kids and getting that information from them to see how it changed their future, because that's really, really powerful. I mean, people are much more likely to support something if you can say, hey, we had 20 kids in this program 3 years ago, and of those 20 high school seniors, X number graduated, X number have gone to college, X number have really great futures. And any kind of quote or direct personal story you can get, that's pretty powerful stuff. Yeah, growth is transformational, and teens often don't see anything happen. That's true. That's true, right? So my oldest child is 12, and I'll often ask him after I send him to some phenomenal camp or some really great thing that I think is going to be really enriching for him. I'll be like, so Holden, how did it go? And he'll be like, we did stuff. But I'll see little bits and pieces of it later on. I'll see him handle something a little differently, or I'll see him take an interest in something that he didn't before. So yeah, you're right. It's hard. It's especially with kids and youth. It's hard to see, for them to see that in the moment. So that's what the brainstorm on is what are the most important things you hope to accomplish while they're in that program, and that just like 2 or 3 things max. And then is it their teachers? If they're referred by the teachers, I don't know how kids come into that program. Is it their family? Is it their friends? Is it their teachers? Who refers them to you? Why are they there to start with? And then what do other people see when it's over? But that one definitely would require some follow-up that is future based, trying to get the input of folks around them in the future if possible, or of them. Hey guys, have I missed anybody? I don't know if I've been doing a good job of keeping up with the chat, just trying to scroll through and make sure I haven't forgotten any of these great questions. So, data collaboration access with partner agencies, will that ever happen? Okay, Paul, I'm not sure I'm not sure if I understood that question or answered that question correctly, the one that you had about looks like data collection or collaboration and access with partner agencies. Will that ever happen? I think that's could others share data with partner agencies? Absolutely. You just have to set up that framework and between the other agency, and as well as making sure that the people that you serve are aware that you're sharing information with them. So a good example of that is, when the homelessness program, we obviously referred a lot of folks to our local assistance agency, which did financial assistance, clothing, food, and that sort of thing. And so a part of the entry paperwork was, we partner with X agency, so we're going to be sharing the essential information about you, about your needs, and how to reach you with that agency, whatever that information may be. Or it could be that you say that you're going to share the outcome, whether or not they complete the program successfully with a certain agency. As long as you're transparent about that and include that in your conversation with them, and you have that set up, there's lots of different ways that information can be shared across agencies and successfully, while still maintaining the person's privacy. So there's software for that, there's forms for that, there's lots of ways that you can do that, from super simple stuff to more complicated stuff. And there's a lot of ways you can share data that's not personally identifying too. So if you wanted to know, I can pick up the phone now or send an email and find out, how many folks has that agency given food to this week. That's just a head count if that's something that I'm trying to measure, or or social media or marketing, how many folks have engaged with a certain post that someone does or something. So there's ways to share information without without compromising privacy. But anything that is related to personal identifying stuff, you definitely need to get the person's consent that's being shared with that. Is that normal, or do others frown at that? I think it's very normal. In my experience, most human service agencies, especially if you're doing anything for any period of time, it's going to need to involve somebody else. You're going to be referring somebody to somebody else, or somebody else is going to care about what you're doing from a professional standpoint. So, you know, if they're already involved in case management or assistance from a different program, it's usually very helpful if they kind of have some input from you about what's going on with that person, how successful they've been in your program. So it just depends on, again, is it personally identifiable information or not? If it's not, share away. It's usually a matter of a phone call or an email. But if it is personally identifiable, then just make sure the person consents to that, either before you start serving them or at any point afterwards, because we do have to respect that. All right. Well, anybody else? I think these are great questions. Thank you, guys. I'm always fascinated to see what sort of situations come up. I love solving problems. When I used to work for pharmacy, in a pharmacy, that was my favorite thing, was being the problem solver. I love weird situations and unforeseen circumstances, or things that are difficult to figure out how to apply something to. So that's sort of my jam. So I will share, I guess, my contact information with Colleen. Would love to hear from you guys. If anybody has would like more conversation with me about something, I would love to help you brainstorm or put you to some resources that will help you with program evaluation. Again, I love it. So it's something I could talk about all day for fun. So I'll nerd out on research methods anytime. And it's one of my favorite parts of my job. So anyway, I guess that's all I've got for you guys. Oh, hold on. Somebody's got another good question. Have you ever measured success when the mission was to create synergies between different communities with different cultures? Ooh, that's a good one. That's a really, really good one. To create second order effects when you connect others. So the closest thing I have come to being personally involved in with that was a group that sort of a short-term task force that evaluated law enforcement and minority relationships in our community. I think that's sort of a thing with our culture clash with. So, and that was sort of a multi-step process in that particular situation. There was some data that was needed. First, they collected data on the number of instances in the last 12 months where law enforcement had to use one of their measures of force, you know, and then having that definition of what that meant. And then the other part was feedback from the minority community that was collected by some ministers on people, how many reports or complaints. Well, first of all, how many official complaints had been made to the actual municipality, and also how much, you know, rumor or, you know, incidences that happened that were had gone unreported. And then sort of compiling that together to see if that matched, and then see where it was missing, but then also kind of discussing, it was a lot of dialogue, just a whole lot of dialogue. But the goal from that was to both encourage people to report instances, make them not scared to do it, make them feel like they would be heard if they did, that it mattered. And so improving transparency, that was one of the objectives, was improve transparency so that the communication was better, and ultimately so that instances of tension or force would be reduced. So that required some longitudinal data from the next 6 months, 12 months, or whatever. So, so in terms of like connecting cultural stuff, again, what's the problem per se? What's the objective there? Relationships working together, reducing conflict, improving some sort of efficiency of something, creating a third thing out of that. They're really kind of pinned, but there are ways to establish some measures of success for that. Alrighty, folks. I hope that was good. Hope that answered your pressing questions. And again, I am more than happy to talk to any of you afterwards, or to talk to, I'd love to talk to boards or to groups of folks too if they're trying to brainstorm on something, because all human service programs, that's just a core piece of it. You got to be able to know how you define success, how you measure success, and then how you use that information to improve. So what's good for some of us is good for all of us. So want everybody to have great programs that are very effective and meet the needs of people. So there's Colleen. Thanks, Colleen.
Thank you so much, Salem, for being with us. Thanks for your time and your expertise. For those of you who have joined us, we thank you as well. I'm going to take a page from Salem's book here, and I'm going to put our survey in the chat and ask all of you to please take a moment to fill out our survey and let us know how we're doing here, and what we could do differently, and more importantly, what types of topics and programs you would see in the future. Hang on a second here. Okay. So coming up, we actually do have Amy Lytle from Hands On Northwest North Carolina. She's going to be discussing the board's role in fundraising and to celebrate, not celebrate, to in honor of, not in honor of, I'm not sure what I'm trying to say here. Hurricane season begins June 1st, and on the 1st of June, we are planning a disaster panel to talk about best practices, lessons learned, and to hopefully get us a little more focused on disaster readiness. So if you'd like to join us on those two dates, we will have the links sent out in an email that will go out tomorrow afternoon. That will also include Salem's presentation and any other information that we have for you. So thank you again for joining us, and I will wish you all a good afternoon. Thank you.